Go. Hi, I'm Beret from Body Mechanics Orthopedic Massage New York. We're here today to discuss TMJ, temporomandibular joint dysfunction, and our treatment that we do here in the clinic for it. We have kindly this volunteer Chris, who's a client of ours, and he has tested positive for TMJ. We've given him some orthopedic tests, which includes we've looked at whether or not he has a deviation. It's going to look like this. He has jaw pain. We've also tested him for a 3-finger test to see how far he can open his mouth, and he has limited opening ability. This treatment is actually part of a larger treatment. Normally we would have treated his pecs, his shoulder girdle, and shoulders. A lot of people with TMJ also have shoulder dysfunction. You'll see people that have subscapular dysfunction, also shoulder injuries, and we've done a lovely warm-up for his neck and a very gentle facial massage, just to get him used to the idea of us touching his face. We're going to now proceed to the intraoral work, and I'm just going to ask you, Chris, to very gently open your mouth. It's going to look like this, okay?
Okay.
I'm just going to take my thumb and I'm going to slide it into his mouth along the side. I'm going to use this hand, and I can actually feel up all the way along the zygomatic arch and down into the mandible area. So what I'm doing here is, you can see I'm pulling out a little bit, and I'm going to anchor into his tissue here. So I can do a little bit of trigger point work on his muscles from the inside. I'm going to go ahead and hit this trigger point here. Take a deep breath in for me. Now the action that I'm using with my fingers is slightly out and then a pull up this direction. So it's a stretch of the muscle and trigger point. Go ahead and take a nice deep breath in. Now I can access the masseter and the paragoids, both lateral and medial this way. I'm just going to move a little bit. Take a nice deep breath in for me. To increase the tension a little bit, I can then take my other thumb, anchor into his ear. Is that comfortable for you? You want to check in with your client the entire time. This is gentle work, but some people might have a little problem with you having your hands in their mouth. So I'm going to create a little tension between the two things. Nice deep breathing for me. Good. If I still wanted to increase tension and motion, I would have him rotate his head. It's going to extend the neck muscles. Good. And now I have a 3-way traction, essentially. The action is now pulling slightly this way rather than this way. And then I'm pulling back with the ear. Nice deep breath in. Good. Now I could also take in here through the digastrics. I can feel you're going to have omohyalite in here, and there's a sling under here that holds things, and then the hyaloid bone. And I want to make sure these are getting treated too. Nice deep breath in. Good. Is that comfortable? Good. Nice deep breath in. Excellent. Good. And go ahead and rotate back to center. You might want to give him a chance to close his mouth. Often people, the salivary gland is right there. So if you're pressing on it or you're doing tractions on it, you might trigger that response. You want to give people a little break. I'm going to make sure my hands are a little bit dry. Take off my gloves. We're going to move on. We would have also done this side of the face as well. We want to make sure that he gets both sides done. I'm just going to check in with him, see how he's opening his mouth. Go ahead, Chris. Open his mouth. Good. Now we're seeing a little bit of deviation. That might be normal for him. He might have had that the whole time. But really what we want to see is a nice, clean opening. We're just going to look here. We're going to go to the temporalis muscle. Feel, see if there's any trigger points. And then to continue that release work of the muscles, we're going to anchor into both sides of the ears this time. Is that comfortable?
Yes.
Great. And I'm going to pull slightly down and out, so it's an action of this and that. And take a nice deep breath in and then out. And you might be able to even see on the video that there is a little bit of release in there. Contraction a little bit this way now. And then out. Good. The muscles that anchor the ears run, there's a small tab of muscle here, here, and here. So you're going to access all of those things. It's going to feel like a really great release if they've been having this bruxism or grinding of the teeth. That's going to be affected. Now we can get a little bit further into the actual joint by doing that same motion. Now, Chris, I'm going to have you very gently open your jaw. Good. Do you feel that into the joint?
Yes.
Good. Go ahead and open again. Good. Can you do it a little bit wider? Good. Good. Very good. The jaw has two motions. It has this open, and then it also has this little protrusion. So you want to make sure they're going through the full range of motion where they're doing it, because that's the goal, to get them back to normal range of motion. Just going to go check in here for see if he has any trigger points up into masseter. And if he does, we're just going to do these little fascial glides, trigger points in there. Go ahead and open. Now I can feel for the deviation of the jaw as he opens. Go ahead and close. Making a little active release here for him. Go ahead and open and close. And I can actually feel on the left side there's a small difference in the way his jaw works. Go ahead and open again and close. And one more time. Good. And close. One more time. Good. And close. We're going to go ahead and find the zygomatic arch here. Now, temporalis runs right underneath that. So we're just going to work right underneath the zygomatic arch, follow it up. It's on the temporal bone, shaped like a fan. And we're just going to feel into there, give it a nice massage, warm it up. And then we're going to put our fingers on there and get a nice little traction back this way. And do that same thing. Go ahead and open gently and then close. Is that comfortable?
Yes.
Go ahead and open and close. Good. And open and close. One more time. Open and close. Now to finish off the treatment, just want to go through, check, make sure that there's nothing we haven't done. Make sure all the tissue feels soft, pliable. You have any other areas of pain, Chris?
No.
Great. And we'd finish up with a nice neck massage, close out the treatment, and probably work back into the scalp, working his nuchal line and on the GTOs, Golgi tendon organs, getting him to relax through there. We might add in some fascial work for the neck to complete the treatment. But we just want to close out, make sure our client has had a really good experience and that all his needs have been met. If you want more information on this treatment, you can find us at bodymechanicsnyc.com. Thanks for listening.